Great, thank you. And I know we have a few more members from the compliance holding team joining, and then if you'd like, I can kick it off and then hand it over.
Perfect. We've, I think, Brian, do you have everyone on your team? Is Matt joining?
We're just waiting on Matt Walker to join.
Good afternoon. I'm Terry Gonzalez. I'll wait for introductions, but my Jabra has decided to take on a life of its own. So I apologize if you guys hear the whistling. Can you hear it? I'm going to stay on mute, but it's just randomly started doing this. So I'll mute my mic until I am compelled to speak.
Gotcha.
Okay, I see we have Jim. Do we want to give it a minute to let Mark join?
Yep, he should be joining anytime.
Okay. While we're waiting for Mark, I can just set this up while we're waiting. So the point of today's call is to just go over some highlights of the proposal you provided. The compliance holdings team would like to dig a little further into discussing the pricing structure, what strategic partnerships look like, how account management is handled. So knowing that they're a smaller company, so I want to say, how is a small fish in a big pond handled? So their needs are addressed and met, and then any value adds that you want to touch on, like what is included, and then what would be a value add as a cost.
No, Allison, absolutely. We built the presentation based upon the email and how we, more
Right.
importantly, would consult. We don't look at it as a small fish or, it's very client focused. And you could be a 50 employee group or you could be a 20,000 life group. It's the same blocking and tackling. It just might be a little different funding mechanisms. And Brian and his team will talk over that. So
Right.
This is everything we're going to talk about. And we really want to leave this discussional and make sure we're addressing any questions your team might have.
Okay, great. And I see that Mark is now on. So if we would like, we could do introductions on the compliance holdings team and then hand it over to Gallagher.
Perfect. Thank you.
All right, I'll kick us off. So I'm Terry Gonzalez. I'm the Chief Human Resource Officer for Compliance Holdings. I've met some of you before, but nice to meet those that are new to the conversation.
Great.
Hi, this is Jim Bertino, board member working for Water Street in support of Compliance Holdings.
This is Mark Combs, board member of Compliance Holdings.
Great.
I think that's it.
Well, I think that's it on your team. So Chris Schickling, I'm the managing director of our private equity and M&A team, then lead the human capital practice. So that means diligence, pre-acquisition strategies, as well as leverage purchasing strategies to ensure that we're supporting with our private equity clients the best consulting possible to achieve your goals and objectives. We really do focus on creating scale and infrastructure, which we feel to be critical with compliance holdings. We can also help facilitate discussions around a broader partnership. So really excited to present what the team does here and how we would support. Will?
Hi guys, I'm Will Fitzsimons. I lead Gallagher's private equity and M&A team. So working with investors such as Water Street, and have been for a number of years over there, kind of on and off. I've been with Gallagher 8 years and with Marsh prior to that, and kind of responsible for the overall strategy from both the benefits side, which Chris's team is, and then the property casualty in the event that that's an opportunity or an area for you and or Water Street. So kind of overall leading the private equity and M&A team that works with investors and their various portfolio companies for Gallagher.
We've also got Andrew Cole, who's not on this, but he's the lead relationship manager for Water Street.
He just joined.
He just joined.
There he is. So he's listening in.
And then we've got Brian Tolbert. You want to introduce your team, and then we'll get moving.
Sure. Good to meet you all. Brian Tolbert, I run the practice that focuses on the 20 to 250 space. I think Chris said it best. I mean, we think about, I think you all have referenced this as small group. We think about some of the strategic ideas and financing options available to small businesses, just like we do 2000. And so my team that you'll meet here shortly really focuses on the 20 to 300 space.
Matt?
Yeah, I can jump in. Matt Walker. I am our primary health benefits consultant in the 2 to 300 space. And so it's been my role to sort of bring large group solutions down market to our small group clients, whether it be self-funding or just other creative ways to look at healthcare financing. So that's the bulk of what I do for that segment of our business.
The Molly Beer's not on the call, but if there's a qualified, non-qualified retirement side, we wrap that into the human capital sheet.
Oh, and Chris, I think you froze there for a minute there.
Chris, I
Can
think
you
it
guys-
throws up right after Molly Beer and then qualified, non-qualified.
Yep.
Yeah, so Molly would be supporting any retirement.
I'll finish this sentence for him. Molly Beer will be supporting any, 401k, retirement programs, everything along those lines. She's currently not on the call, but in the event that you guys need that expertise, Molly is a part of our team and she can handle that side of it as well. So maybe while Chris is either dialing back in or kind of finding himself here, Brian, do you or how do you guys want to go forward?
I would say just briefly to round out the rest of our team. Allison, did you want to make an introduction? And then Ben?
Yeah, I can go ahead and go. So good afternoon, everyone. I'm Allison Cunningham, so the other Allison on the call today. I lead our client success team, where it's our goal to ensure a quality experience as we're assisting our partners with healthcare. My team is split into 2 separate departments that report directly to me, one with more of a focus on assisting individuals with healthcare, while the other focuses on employer customer service. So my employer team acts as support through items like yearly renewals, and we also manage a help desk that creates a direct connection between the employer employee to our team if any questions or issues do arise with their coverage. Graduated from Clemson University, so go Tigers if there are any Clemson fans here on the call today, maybe not. Still currently in South Carolina, where I do work remotely for the Brentwood office. So great to meet everyone today and looking forward to learning more about our services. And I'll kick it over to Ben.
Thanks, Allison. Afternoon, everyone. My name is Ben Crownover. I lead the HRIS team. I'm a Nashville native, but been in the industry about 10 years. Everything from client service, account management, but really helping employers navigate and implement HRIS systems. So I'll kick it back to you, Brian.
Chris, looks like you're back. I think we're ready to roll.
Yeah, sorry about that. I'm going to go off screen. I don't know what's going on with the internet, but I want to try to minimize bandwidth. So again, I apologize for that. So who is Gallagher? We're a local team, but global focus. So you'll see the team members that would be supporting you are dedicated specifically to your industry. Gallagher is the 3rd largest insurance consultant in the world. In terms of what does that bring to you? It brings leverage and, more importantly, the expertise to help manage and support your growth and overall goals and objectives. So being a former Marine Corps infantry officer, I take it very serious to ensure that we're exceeding your expectations and ensuring that we have the team support that. Specifically for this, you would have our private equity team supporting both on diligence and leverage purchasing strategies. Brian is a part of that. He helps support our sort of lower middle market opportunities, but that team is built out specifically for private equity investments. We have the expertise and strategies, not only from the carrier side, but also, as you'll see, from the technology consulting side, and the ability to help you really scale and create that HR infrastructure, which is required to help support the growth. So Brian, do you want to talk over the pricing methodology and how we'll look initially to take commissions and then go to a sort of a level PPM model?
Yeah, thanks, Chris. So these are just generic emails from insurance carriers that note how the plans work and how commissions work. Essentially, if you have less than 100 employees, the plans are gonna be the same, the rates are gonna be the same, the commissions are the same. And so it's my understanding we're pulling together 3 fully insured plans, each of which have less than 50 employees. Allison, am I thinking about that right?
So I believe, CH, you're actually at what, was it 117?
117, yeah, total will be a single control group for the 1-1 plan.
Okay, perfect. So what we typically do is, again, we focus on helping transition. Is we will take whatever the comp is that's currently embedded in the plan. I prefer to work off of like just being paid a percentage of whatever your premiums are. We'll convert it to a flat per employee per month. The premise being, if you get an 8% increase on your insurance cost 1 year to the next, we shouldn't get an 8% increase. This is better alignment because if you do add 20 employees, then theoretically our work is going to go up. And so we will just convert this to a per employee per month amount. Did I explain that okay? I know there were some emails back and forth on that.
Jerry, do you understand the pricing when we do our comparison?
I do.
Okay.
Yeah, I think it allows us to know that we're in a level playing field. So we're going to continue to give you the same value and services without increasing our compensation due to increased premiums. Again, we keep hearing you feel like you're concerned around being a small fish in a large pond. You're not a small fish. You're a complex entity. James, you talked about a control group. We understand the complexities around control groups. We don't want to create a MIWA. So we're going to be very focused on private equity and add-on acquisitions. That is a more complex client than a client focus. And what you'll see in this presentation is the deliverables that we'll be providing are focused on that middle market opportunities in size. So the proactive services, what does that entail for your team? Everything in that core service investment is what's going to be offered. Areas where additional compensation or fees could be is retirement. That would be covered through commissions or fees. Workforce evaluations, depending on the size and scale, we'd most likely provide that pro bono. If there's any requirement for very tailored, custom, technology-driven communications, there potentially would be a fee there as well. And then any type of compensation consulting, there's potential fees there. But for the core offerings, those are entitled and would be provided in your team. The key areas we'd focus on is number 1, compliance. Number 2 is the HR technology component, which Brian and team will talk over that Bernie portal. And then overall, how do we manage trend? And then secondarily, offering benchmarking to ensure that, Terry, your team has the best plan designs and offerings to ensure that you're attracting and recruiting T talent. Our benefit survey and benchmarking is the largest in the industry. So it's going to give you data and knowledge to make sure that you have the most competitive and benefits offering at a cost-effective price. Are there any questions that we have on this? And I do want to talk over communications. That is going to be critical when you're integrating 3 companies into one, right? We don't want to have any disruption. If there is disruption, we want to make sure we're communicating it and managing it accordingly. So we'll discuss that in the next couple slides. Terry, do you have any questions, or Allison, James, or Mark?
No.
No questions here.
Our client service approach, it is a team approach. So you're going to have Brian and his team, Matt and Ben and Allison help support that. You'll also have project managers on the due diligence team for any add-on acquisitions or requirements around due diligence, integration, harmonization. You'll have subject matter experts around funding, around potential, if we do look at, further down the road around self-insuring, around pharmacy, you'll have subject matter experts that would be dedicated to support that team, both from a financial component to make sure to give you the knowledge of your financial health of your plan, as also as procurement for pharmacy and so on. I'd say we're probably a little early to look at that, but we're still going to take that analysis each year to make sure that we have the appropriate funding and we're maximizing the leverage we have to manage costs and risk. Brian or Matt, do you want to go into detail before we move forward?
No, I think you can go ahead and go into the next slide and we'll kind of pick it up directly from there. Allison.
Yeah, I'll go ahead and take this one. So as mentioned during my introduction, one of my teams manages a help desk called Ask GBS that allows employees, HR, owners of our groups, direct access to our team for any questions that they have on their coverage, as well as any assistance with issues that may arise. It's very important for us to ensure that HR as well as owners had access to our desk, because it's really our goal here to take a lot of those questions off of the group themselves, so it frees up their time, also allows quicker response times on questions that come from the employees. So for example, we may have an employee that is noted, claims aren't being paid properly by the carrier. So in this case, instead of that employee having to spend countless time trying to get in touch with the insurance company, try to figure out the root of the issue as well as resolve it on their own, our team is actually able to step in, connect with our direct carrier contacts to work on resolution for that employee or the group. Now on the slide, there are lots of colorful charts, which are very important to the effectiveness of our desk. We're actually able to create analytical reports based on tickets that are received from our clients. So our ticket reporting system really allows us real-time feedback on how quickly we're responding to our clients, how long it's taking for full resolution of these clients' issues, as well as how long it's taking to hear back from entities like the carriers themselves. Now, we've also found these reports to be very helpful for discussions with our groups. So we can personalize the reporting to create items like utilization reports. So how often is the specific group using the service? And maybe we find that they aren't using it, which presents that perfect opportunity to inform them that the service is available to them and their employees. And we can also look at efficiency of us helping with questions that come directly from the group. So how quickly are we answering this group's tickets and resolving them? Really trying to fix that root cause of the issue so that the consumer has a great experience with our desk. Then we can take this information back to our team. We can use it for coaching to ensure that we're taking proper steps to provide the best service to the client. Now, one other item that we found helpful is using these reports for identifying employees that may be turning 65 soon or may be eligible for Medicare. So in these cases, sometimes employees will reach out to us and tell us that they are very much confused as to what's going to happen to their group health plan when they turn 65. Or we may notice trending where certain employees are utilizing our desk heavily because they're experiencing really high cost. So in this case, we potentially found that high cost claimant. As mentioned earlier, I do manage a team of non-commissioned advisors that also assist with helping individuals with their best healthcare strategies. So in this case, it really helps us to identify those employees that may need that connection to this team to ensure that they're enrolled into the best healthcare coverage for their needs. So really all that to say, our help desk has been a great resource, not only for reporting, but for the feedback that we get from that reporting, just because it creates that direct outlet for our groups, which helps to reduce confusion, as well as helps to ensure that our groups get the assistance that they need with their coverage. But any questions here on our help desk?
So Alvin, how does the so one of my employees was to call because they have an issue with ID card, whatever it is, prior auth, they're at the doctor's office and they're stuck. Are they going into a queue?
Yep, so they would.
You said you have 9 people that support, right?
So they would go into a queue. So what they'll do is they'll actually use that email address there, which will create a ticket in our inbox. So then they'll go into a queue to let our team know that this person needs a response on their issue or they need an ID card.
And just, if I could jump in, Allison, could you give a little bit of metrics on average response time and then average closed ticket time?
I can. So as far as first response times, an employee is going to receive a response from us within 24 hours. Even sooner, potentially. We'll have some people that may have more of an urgent issue where they can actually tag that in the subject line if they need a response within a couple of hours for our team to get to it. Generally with resolution, it's going to take about 48 hours for resolution, with that kind of pending on how big of an issue that we're having. So if it's like a billing issue that they're running into, we are having to connect with that carrier, which is a piece there that we're having to wait on the carrier to resolve that issue, but generally no longer than 5 to 7 business days, even with those larger issues that may occur.
And I think what's unique about this, it's the two things that Allison talked about before. The first is we're trying to get stuff off of HR's plate. Typically in organizations this size, we're working with an HR party of one. right? It's a sole person. Maybe they have a second person. Oftentimes they're not, they don't have a 25-year track record working in HR, right? They're sort of jack of all trades. We're trying to get as much of this transactional stuff off of that person's plate so they can go work on, improving absenteeism and whatever the HR priorities are, right? So that's the first piece. The second piece is, I think a lot of people are going to say, hey, we provide good customer service. And first off, like, how do you know if you're not tracking it? So this is our ability to track it. The second, element to that is this gets these emails and these questions out of people's inboxes, right? If someone emails me a customer service question, like, they're only relying on one person. So this round robin style allows sort of the whole team to be able to respond and jump on something, giving a more accurate, a more timely response. When you do have that employee that has their daughter at the dentist and they're not showing as having dental coverage, we get that one a lot, and we're able to quickly get that turned around. Does that help, Terry?
Yes, thank you.
Any other questions?
I can jump in here. So just to reintroduce myself, I would be your health benefits consultant. So it would be my job to help ensure that you are doing the best thing as far as strategy goes to have a sustainable health plan. What that looks like is working hand in hand with Allison on ongoing issues. So we would be chatting about things that are hitting the help desk for some of that low hanging fruit. So sometimes at the help desk, we see that somebody is struggling with Medicare. Oftentimes that's just an easy introduction to our team to help them evaluate whether Medicare could be a better option for them. So ongoing, working hand in hand with Allison. There's also a monthly reporting component to it. So I would be monitoring your monthly financial reports, working on open vendor items if you have any. And monthly is sort of where things are interesting, but maybe not actionable yet. And so in monthly reporting, sometimes we see a really expensive prescription that we could address. But it's really once we get to sort of the quarterly reporting, which is where we would have sort of a quarterly standing meeting. We sort of start to see trends. And so things go from interesting to more actionable. So we would review your health plan trends to see what types of things are showing up, whether it's the prevalence of a specific medication type, a specific type of visit, and really start to introduce creative ways to address those types of issues. All of that really spills over into our annual renewal discussions. We've got all of these pieces that are sort of just connecting to that full picture of your health plan. And so all of these pieces would go into our discussion each year at renewal with the goal of just being able to offer the most sustainable and affordable health plan for your employees. The next slide.
Real quick, I do want to make sure that working as a team, Allison and Terry, Matt's going to be leading the day-to-day. Ultimately, it's my job to ensure a successful partnership. So I'll help oversee Matt and Brian, and I'll be coordinating that. But to ensure that we're the one throat to choke to make sure that we're exceeding your expectations. So very focused on that.
I know it's like a dumb question, but so between Matt, Allison, whoever the support team is that is on our account, if I have an issue or I have a team of two, we've grown. So if my benefits person has an issue, are they going into the queue with the 24, 48-hour turnaround, or are you picking up the phone when I call?
Yeah, I can.
How does it really work?
Yeah, I can address that. So the goal is for you all to be able to reach me whenever you want. And so for like our HR and C-suite employees, I would be managing that relationship, and you would have my cell phone number, my direct email. The goal though is for the general employee population to use Ask GBS so that we can better track their issues and our response times. Okay. But certainly if you've got an issue, you would always be able to reach out to me via text or phone or email.
Does that answer your question there, Terry?
It does. I'm new to the small group world, so you'll have to educate me,
We try to bring the same complexities to middle market, upper middle market, down to the small group or what I will call lower middle market opportunities.
So this, I'll let you look at it for a second, but the sort of the long story short is this is what an annual calendar would look like. So all of those pieces, those components that we just talked through, we would schedule out onto a calendar at the beginning of the year. And so this is kind of what Chris is hitting at. We implement something very similar to this for all of our 200 to 300 self-funded groups. And so we're able to really bring a level of service that isn't common in this size segment by sort of taking a proactive and consultative approach. And so shortly after, if you decide to work with us, shortly after, we would create a custom calendar like this to sort of hold us all accountable as we walk through the year towards your 1/1 renewal.
Okay, so I'll jump in here, and this was in the RFP, but this I think best illustrates sort of how we think about healthcare. We talk about 2,000, 8,000 life employers and all the cool things they can do. We have found you can do that in small group too. So it really starts probably where these 3 plans are right now, which is the top left. You're fully insured. You get your renewal. You have 3 levers to pull. You can make the plan worse by raising the deductible, changing the copays. You can introduce an insurance product, or you can shop carriers. Sort of is what it is. As you continue to grow, you can move down the continuum. So the idea around dividend eligible is a level funded health plan. Terry, have you heard of that?
Sorry if I mean, yes, I have.
Okay. So
I've never
for those
used
that,
one, but I've heard of it.
okay. Well, so for those of you that aren't familiar, the premise is basically you pay what you're paying in healthcare, and you get more reporting. You get more transparency as to where your healthcare dollars are being spent, which is representative of the pie chart there on the left. And so then the premise is if you have a good year, then you get a dividend back. And a good year is merely that you didn't spend all quote unquote 58% of what was earmarked to pay claims. And so you get a dividend back. And Cigna offers this, Blue Cross offers this, United Healthcare offers this. So this is the first idea, the first step towards going self-funded is, hey, we're still going to pay at our max liability here, but now if we have a good year, we're going to get some money back. So that's the first step. The second step, of course, is going self-funded. Again, we specialize in small groups self-funded. We have groups that have 45 employees that have been self-funded. The premise with that is just taking the dividend eligible concept one step farther. If you have a good year, you get all of the money back that was left over in the claims fund. And so once you're self-funded, now we have real-time access to your claims data. And so this is where you can get very creative in trying to drive down cost. The different ideas that we've seen there are in blue. So the first is just auditing claims for accuracy. Medicare is the largest payer in healthcare. They will tell you 4 out of 5 bills have just errors on them. So the ability to get in there and audit them for accuracy, you can save a lot of money without really making any plan design changes. Avoiding unnecessary claims, 2 categories I'll give you is, half the hospitals that your employees go to have their babies delivered are actually worse than the other half of hospitals as far as outcomes and price. It's really sad to think about, but nobody knows, right? So the premise around avoid is helping people get the data around outcomes and cost. And then of course, pharmacy is a huge one. We have clients, again, in the under 100 space where we're purchasing a lot of the specialty pharmacy overseas from England and Australia and saving tremendously. Again, this doesn't mean people aren't getting the care that they need. We're just avoiding the really, really high costs, pharmacies. Direct is we're negotiating direct contracts with providers, and negotiate more commonly is references or is referred to as reference-based pricing. Are you familiar with that?
Yes.
Yeah. So on the one hand, you get to avoid that 5% you're paying for a network because you have no network. On the other hand, we're negotiating directly. So we have groups that are doing reference-based pricing. As you can see there on the far right side, that $1. This is just to illustrate that when you're fully insured, whatever your healthcare budget is, you're paying that money in, and that is what your budget. And so as we help employers transition down the continuum, it's our jobs, it's Matt Walker's job to bring these proposals, to bring these preferred vendors to you help you understand how they all work so that you all can make an actionable decision. We see employers the first year they'll go self-funded, and then there's other things going on in the organizations. The plan's running well, but they don't want to mess with it anymore. And then they'll come back, 18 months, 24 months later, and they'll want to understand what the next step is and try to drive down costs. And so that's our responsibility. Of course, the last step is that captive piece. The idea here is, yes, if you have a really, really good year, you get to keep all of your unused claims dollars, but captives are really powerful because at some point we will conclude that we're paying too much for reinsurance and we won't be alone. And so what we do is we join other employers to buy our stop loss, to buy our reinsurance. And then the idea is if the stop loss performs well, we get that money back too. So again, we have clients that are all over this spectrum. It sounds like we're walking into a situation where we have 2 or 3 plans that are currently all fully insured. And so it's going to be our job to review all of those, benchmark them against one another, take into consideration employee contributions, and then understand a little bit more about what the goals of the organization are. And then it will be our responsibility to bring you the strategies around dividend eligible and small group self-funding so that we can try and drive down costs and improve the benefit.
What's the sweet spot for self-funding? You said you had one group of 45. That was interesting. So what's like the average size?
Yeah, it's a great question. So what I've found is that if you have the employee-only rate, if the employee-only rate is less than about $425, and if you have more than 50 enrolled, you should go self-funded. Now, yeah, it's a lot more work, but that's also why you have a lot more people on this call than you typically would for small group, right? It takes the help desk. It takes getting a lot of this stuff off of the HR's responsibility so that Matt can focus on some of these ideas around international sourcing of prescriptions. And obviously there's a communication that needs to take place at the CFO, at the HR level, and at the employee level too, in order to be able to capture that. So that sort of concludes the strategy. We have found that this HRIS piece is important to small to mid-sized employers too. And so I was going to hand it over to Ben, but before, are there any questions on the strategy stuff?
I'm good.
Okay.
Great. Thanks, Brian. Again, my name is Ben. I lead our HRIS team. It is really important that employers get consistent communication out to their employees and really spouses as well. Part of that communication is the typical benefit booklets, summary of benefits. But one thing that we and our team really do like to do is record an open enrollment video explaining the benefits to the employees and their spouses. And then we can put that into a YouTube link that we can embed really into any HRIS system. From what I gleaned from this call, we have 3 different organizations. Do they all use the same payroll company, or is it 3 different ones?
Well, we have 2 big projects going on. So we have the benefit situation, and then we have we're standing up ADP as we speak. So ADP payroll will go live June, July for all the companies US. So we'll bring them together, and they're right now on multiple different platforms for payroll. All of them have different benefit brokers, different benefit offerings, all kinds of craziness. So it's for 2025, we'll be on the new payroll. We'll be using ADP for benefits enrollment with new carriers. So it's lots of communication is going to be probably the most important thing, is because they all are coming from different plans, different, ways of getting paid. Everything is different. We're going to just really shake up everybody. So very clean, crisp, concise communications are going to be very important, and project plans. I can tell people when things are happening. So this is a big one for me.
Yeah, definitely.
Hey, Ben, can I just jump in here real
sure.
quick? Terry, good for you. It is a big list to get the payroll and HRS platform sort of pulled together. It sounds like you've done this before.
I have.
Good for you. I think what Ben's going to talk through, we've got a vendor that we've worked with a lot that could be just a stopgap if things fall through, if benefits doesn't get set up right away. Otherwise, we'll just be in the background supporting with all the ADP as best we can. So Ben, I'll pass over to you.
Sure, absolutely. If we could go ahead and go to the next slide. Really, as BIN admin systems go, this is really the HR ecosystem that you're probably very familiar with. It's very disjointed, as Brian mentioned. A lot of small employers have an HR party of one. Really, everything in the employee life cycle, from how do I find that employee, an applicant tracking system. A lot of times that's done via email and LinkedIn. When you hire that employee, how do they do their onboarding paperwork? Is it paper forms, or is there a system for that? A lot of times it's just fill it out paper on that first week and file it in filing cabinet. Do we enroll in our benefits online? And so a lot of times employers have multiple systems. It's very disjointed, not cohesive, or a lot of just paper. So we work with all sorts of different vendors. But Brian, yeah, if you could go to the next slide. We work exclusively, not exclusively, we work a lot with Bernie Portal. Bernie Portal is a preferred vendor because they do offer a few modules here for free. The ones in blue, onboarding, so that's going to be, again, your I-9, W-4, direct deposit. Bernie Portal can create custom documents as well that employees can fill out and complete before their first day of work. The benefits admin portion as well, where employees can see their payroll deductions, any provider searches, benefit summaries, so forth. Bernie Portal does offer some free carrier integrations and billing solutions as well, all the way through offboarding. So this platform that we work with also has additional kind of modules that will take an employee through that life cycle. So if we could go to the next slide, part of our relationship with Bernie Portal is we do have preferred pricing. The nice thing about Bernie Portal are these add-ons for the HRIS system are kind of a la carte. So an employer that needs applicant tracking can pay for that, but might not need PTO tracking.
Just Ben,
yeah.
Sorry, if I could just jump in, just because Terry, you all already have a solution here, right? Oops, are you there?
We already have what?
You have a solution here, right, with ADP? Yeah. Just a quick comment. So we will be in the backdrop helping get that up and running. Sometimes it's a lift to get the EDIs built out. You're going to need a broker that understands how that world works and can help push the envelope on getting the carrier to work with ADP. So that's sort of a separate discussion for another day. The only comment I'll say about Bernie Portal is we had a client that was using Paychex. Paychex acquired a BIN admin platform called Flock, and the client had made a decision to use Flock for open enrollment. The morning of the open enrollment meetings, the day before the open enrollment meetings, the client called us. They had about 80 employees, and they said that Flock was going to miss their deadline and open enrollment was not going to be built out. And they asked if we could help support with paper enrollments, which is laughable almost. We were able to get Bernie Portal built out so that people could enroll online, and we could communicate eligibility with EDI, and we could download an Excel spreadsheet for those initial payroll deductions. We were able to do that before the open enrollment meetings the following morning. So our breadth and understanding of the HRS-led landscape is pretty wide. That's a resource you need help with.
We're not even going to put that out in the universe. If that happens, I'm going to be in Siberia or some other, maybe a tropical island.
It's bad. I've just been on these calls, and sometimes the HRS or the payroll people, there's just an element of overpromise and underdeliver, and it typically the underdeliver ends up being on BIN admin, and it falls on the broker, right? Because the broker is then trying to help get things up and running. So we will be there for you if you need us on it.
All right, my safety net. Okay.
And Terry, two things. In terms of ADP, we have a partnership with them that we have a big stick to swing at them. We actually underwrite all of their medical, which is a entirely separate beast. But we have a extremely close partnership with ADP. It is a love-hate relationship at times. But rounding back to the communication strategy, I want to ensure that you understand that we'll have videos and open enrollment materials to support, but most importantly, we're going to look at that plan comparison and make sure that members understand where plans are different, what contributions, plan designs, and then we're going to give you an FAQ, a frequently asked question document, and help smooth that transition from one plan to a more integrated plan. So we really need to dive into detail to look at what that diligence looks like, and then really focus on integration and harmonizing, and most importantly, communicating those plan design changes and making sure those members are made whole the best that they can be.
Great.
Do you have any other questions on communications or that you'd like to discuss?
So are the communications that you've got, like, is there like a repository of all the things that are already crafted? And so Matt and I are gonna be talking about, hey, what's the next thing we want to talk about? Whether it's, we're gonna offer pet insurance, or we've got it's national whatever month. Are those the things, Matt, that you and I work on, or is there a repository that I'm going in and I'm kind of like mining through to find what's appropriate?
I think Terry, if you, I'm sorry, a lot of people on this call. Chris, could you go back a couple slides? This one right here.
Yeah.
The one with the calendar. Maybe 2 forward. This one right here. So Terry, it starts here. This is where it would start. And then as far as like, are you referring to having content for monthly newsletters?
Or whatever. Yes.
Yeah. So we will be providing that, but typically we'll try and put together a calendar ahead of time so that no one's trying to figure it out 48 hours in advance.
Yeah, so I guess my real question is there a repository that I'm going and I'm kind of like looking through, or
on the communications, we'll build out several sort of blank sheet. Like they'll have your detail, but you will review and see what communication strategies you want. In terms of monthly communications, you'll have well-being communications, compliance alerts, and we'll provide all that pro bono as well. But in regards to specific communications, we'll also develop tailored FAQ documents, as I mentioned, to make sure that those members understand what that disruption looks like. But you'll have 3 or 4 guides as a baseline to look at, and then decide which ones you best feel will support your team.
Yeah, I'm asking that question because, again, I have such a small team. I'm trying to evaluate what's the level of effort, because Camilla is also the payroll processor, so now she's going to be helping with benefits. So what's the level of effort that I need to expect for my team to have to generate these things as we continue to grow?
Our job is to bring the ideas and innovation to your team's to make the decisions. That's how we look at it, right? Is to be proactive, to be up as front as possible, to say, here's the options we have, right? And we have a detailed timeline on that that will go into details in the next few minutes. So you can see when we'll start planning this, when we'll finalize plan designs, and so on.
Perfect. Okay.
And this is part of the M&A due diligence, right? So when we look at this, we really don't have a ton of detail on your plan, right? There's not a lot of claims data, but our job is to look at sort of that phase 3, that custom integration, right? We've got to look at what plan designs are being offered. We need to make sure, number one, James said the plan is going to be one control group. Okay, we're going to take you, make sure it's not a MIWA. And then we're going to start looking at what is benchmarking for your industry, and then look at the 3 plans and integrating into one. So we're going to do an analysis on the 3 plans, provide you benchmarking for like industry size and geographical locations, and then consult on that, and then create a go-to-market strategy to align on that to ensure that we have the most total rewards possible. It is very communications driven to your team members, so diving into depth on that and to make sure that that is set up accordingly. And then long term is Brian and team, what is the best funding source? Is it self-insured? Is it a dividend sort of type plan for next year, the following year? Probably wouldn't do it this year. We don't have enough claims analysis to provide that. I think one area that we do focus, and we look at that lower middle market, Brian and his team brings options that you would not have access to. So they bring those sort of Gallagher marketplace pricing. So Brian, do you want to go over the sort of the perks that you're providing that would be assisting?
Sure. So, if you had 5,000 or 8,000 employees, you'd likely have a pretty robust employee perks program, discounts, stuff like that. So Gallagher has 50,000 employees, right? Third largest brokerage in the world. And so we've developed a marketplace that just by virtue of being a Gallagher client, you can tap into and you can market the Gallagher marketplace to your employees. And so it's preferred pricing on auto and home insurance and discount programs on travel and stuff like that. So this isn't a huge thing, right? But this is something to add to quarterly newsletters, something to put in your handbook, because we know that even though you don't have 8,000 employees, you're certainly competing in that talent pool, right? And so that would be available. And then I think there's something else here, Chris.
And then let's dive into the timeline. So this is just a sort of sample timeline. It is a eye exam that we're going to have in place for your team. Joking aside, but I think it does lay out, if we were going to take over a partnership 6/1, we would start looking at that analysis fairly quickly. And we would do a benchmarking strategy review mid-July to early August to start looking at those. We really do need to dive in to make sure there's no compliance concerns and understand that. And then for the reward, the employee side, we're going to start marketing a fully insured as well as a captive type arrangement for your renewal. So Brian or Matt, do you guys want to go over what in detail this would look like? Terry, assuming real quick, you would want open enrollment mid-November. That is an assumption we put.
I was actually thinking a little bit earlier if we can get it done because we do have so much transition with my employees.
Okay.
So.
Me too. Yeah, me too. Sometimes, we're relegated to when the carriers release, right? So, Affordable Care Act said the least amount of time. So the worst case scenario is they don't issue the renewal until 60 days prior to the effective date. Now we're seeing typically it's 75 to 90 days. And so you can see that 10-1, it says the under 50 renewals are released, but we're going to get a census from you. We're going to start quoting at that time. We've found that given that tight timeline, typically we can finalize what our options are and what our recommendation is, and you can make decisions on contributions by that first week of November. And then we can get open enrollment up and running and have everybody enrolled before Thanksgiving. We've found that that's enough time to get new ID cards out and that kind of thing. If we could get the renewals September 15th, then obviously we could do this 15 days prior, right? But to your point, I mean, small group is we're at the mercy of the carrier here early on this first go around until we bring everybody together.
Yeah, I can appreciate that. I guess on my timeline, I have lots of communications going out even before the open enrollment. So we'll have because again, I do have people that will be transitioning to different plan years, different pay structures, all the, again, like I said before, all the changes I can do, everything I can do at you at one time, we're going to do it.
Yeah. So we were assuming a 1/1 renewal, right? A calendar year renewal, which we believe was an RFP, right? But then we would start looking at communications and what those strategies would be in mid to early August to start giving you that baseline. Again, it's going to be based off benchmarking that Matt and team will provide. And then in terms of the renewal, the final plan documents, you would be receiving those documents mid or early October with final, decisions made by November 1st. We can change that obviously, but as Brian said, a lot of it's dependent when we receive those renewals.
Okay.
Any questions before we dive into a broader partnership and what that would look like?
I think I'm set now. I don't want us to run out of time, so I'll let you go ahead and jump in.
Great. Allison, in terms of the broader partnership, what I can promise you is I believe you do work with our team out of Mississippi, part of your entity. So we need to understand at a broader level of what that looks like. So as the managing director, what I can ensure you and what we've done for other Water Street portfolio companies are, we're going to get you in front of the best in class consultants, producers, and teams that manage accounts to understand what the value proposition of compliance holdings are. I have a very high level overview. I think in terms of a broader discussion, it would start with my team. Brian would be included, as well as our regional leadership teams, to make sure that that is understood. And then you would present what Compliance Holdings offering, and then we would present that to a broader opportunity through area presidents and teams that manage that. What I can't promise you is we're going to give you deals and so forth. But what I can promise you is we'll get you access to make sure that we understand what the value proposition of compliant holdings are, to make sure that you're on a short list if it makes sense for our clients.
Chris, one question. I think we may be doing business in two different logos we have. So I think MZQ Consulting is doing business with Gallagher. I think that's in Mississippi. But I also think CXC Solutions, if that name is familiar.
Oh yeah, I'm actually referring you into another PE deal on a Section 125 non-discrimination test. So I'm actually calling Matt. That is okay. Yeah. So you are one of our preferred providers for Section 125 non-discrimination testing. So if you like, I can't believe I could go either. I actually brought it into a Windrose portfolio company on non-discrimination testing. They're in a PEO. So yeah, that you are an absolutely preferred provider. Andrew Malachowski, our compliance or ERISA attorneys know that. So we would pivot that way and make sure you're talking to that team.
Yeah, because I think that's kind of the way to go is to really allow us the opportunity to get everyone familiar now with who we are as Compliance Holdings. That's not our marketing name. We haven't figured out the name to bring it all together yet. But it's really, if it's MZQ, healthcare reporting, and CXC Solutions.
CXC Solutions, I know you. Yes. Our
yes,
team
and you know them. And so we're doing a bunch of those kinds of things. So I think the opportunity to be able to talk about all the products and services, regardless of what the brand is, to a series of offices and so on, to make people familiar with that, and a chance to become a preferred vendor on other products possibly as well, because obviously we've had some good luck on some of the products.
What I will tell you, if you already are a preferred partner, which CXC is, that is a good path to move forward. What we need to do is, when you rebrand, have all your sort of go-to-market strategy, we can absolutely facilitate, and it's going to be sort of twofold. Number one, we're going to go to our compliance attorney, our ERISA attorneys, right? They're the ones that are helping advising and sort of help facilitating. But number two, we'll bring it to our area presidents and make sure that they understand this is a partnership. We did that. Andrew Cole and I and Will help facilitate that for a reference-based pricing model for a very large health system that we manage. So
I was a part of that as well.
Well, we like that. So that's a good one. What I can tell you, and what I can promise you is we'll go above and beyond. As long as CXC is a great solution, as long as it's a great solution for our clients, we truly believe in expanding those partnerships.
Okay.
Is that fair?
Yeah, that's very fair.
Terry, at the end of the day, what I will tell you is you are not a small fish. You come from an upper market opportunity where you're HR consulting. You're going to have pluses and minuses integrating three companies into one. Our job is to help that create a seamless integration and then long-term manage the commodity of insurance. Brian and his team, the reason I brought their team here, this is all they focus on is lower middle market opportunities, not only from the commodity management of healthcare costs, but you saw we had an HR technology component. They know how to create scale. They know how to create scalability and infrastructure. So our job is to ensure that partnership. Matt will be leading in the trenches. Brian and I will be overseeing to ensure that successful partnership, and we're managing that. So we really do look forward to the value and opportunity to partner with you. It would be exciting. I do want to address one thing, Allison, on the pricing. We really need to go before year one. What I committed to in the RFP is we're going to put our commissions at a standard commission, right? And then year two, right, Brian, keep me honest here, we're going to go to a PEPM, right? So we're not going to increase that commission. What I will tell you is we're transparent. You'll know to the dollar that we make off your account. So very transparent on that, and we'll provide those offerings for you.
Wonderful. All right.
That's
Jim,
funny. I
Mark,
got to call CXC today for a group that's in a PEO that needs a non-discrimination testing. So
Excellent.
absolutely.
And by the way, keep us in mind for all mental health parity needs. No one's better. All three of our companies do it and do it extremely well.
We need, hey, Jim, we're looking forward to having you come in and present to us. We need to know that. Absolutely. So what I would tell you with Gallagher is we're middle market, upper middle market focused, right? We are looking for best in breed services for our clients. So we're very, very focused. If we see it bringing value, we're very dependent on our vendors in that sectors.
Sounds great.
And are you able to share a copy of this deck with us?
Yes, Brian will send it after this call.
Great. Thank you.
thank you so much for your time this afternoon, for sharing the information with us. I appreciate it.
Thanks. We look forward to hearing from you. And thank you
Yes,
for the opportunity and well thought RFP. We look forward to next steps in earning your partnership.
All right. Thank you.
Thank you.
Thank you.
Thank you.